Speaker, we have set ourselves a plan for the upcoming period of 2016 to 2020, and our focus will be on the two pillars of preventive, curative, and rehabilitative health services, and on strengthening the health systems itself. In enacting this plan, our priority areas will be NCDs, because this now accounts for 40% of healthcare. This is an urgent issue, and we will focus on a comprehensive approach to reduce the risk factor by working with people to alter their lifestyle. And on that note, I invite all members of Parliament to participate in the Westpac Walk for Life that will be taking place tomorrow at 6:30 from Mysore Park. Maternal, infant. The other priority will be on maternal, infant, and adolescent health, and we will look to strengthen our antenatal care. Third priority will be on communicable diseases, environmental health, and health emergency preparedness, response, and resilience. We will work to improve surveillance and develop a stronger multi-sectoral approach to risk management. And a reminder to everybody listening in, this is also the season where we've just launched a cleanup campaign against mosquitoes. We invite everybody to go out there and seek and destroy places where mosquitoes are breeding. The expansion of primary health care is going to be another focus for us. In this House, we've had requests for additional services around Fiji, and I can advise members of this House, members of the public, that when requests do come, we assess them, and where we feel that it is the best way to use the money that is available to us, we will make those services available. Developing and retaining a productive and motivated health force is a priority. Having a right structure, having the right people in place, and retaining them. Engagement with evidence-based policy planning, implementation, and assessment. This will raise the standards of policy planning, implementation, and monitoring. Ensuring and strengthening the availability and quality of medicinal products, equipment, and infrastructure. We will work to understand the needs of our communities and begin projects tailored to their necessities. Sustainable financing of health. We will explore long-term financing to assist in government funding. And we also in the ministry will commit to other things that we have committed to, such as the Healthy Islands commitment of the Pacific Health Ministers meeting, where we will walk towards a Pacific and a Fiji, where children are nurtured in body and mind, where environments invite learning and leisure, where people work and age with dignity, where ecological balance is a source of pride, and where the ocean which sustains us is protected. We also pay a special attention to World Health Assembly resolutions, and we continue to work towards universal health coverage. Madam Speaker, the major issue that impacts the world today, especially in the Pacific, an issue which threatens the very existence of life itself and human life, is the issue of climate change. Climate change also has major challenges for health because it has an impact on health in terms of coastal erosion, supply of drinking water, and the increases in temperature. This will also be a major concern to the ministry. I can assure this House and the people of Fiji that the Ministry of Health is focused on delivering all the priorities of the Fiji First government, all the priorities related to health and healthcare, and every day we are building a better and healthier Fiji. And today, I would like to wish all the pharmacists around Fiji a happy Pharmacist Day in the world here in Fiji. In closing, Madam Speaker, once again, I would like to thank His Excellency, Ratepel Naletekau, and the First Lady, Andili Kwela Naletekau, for the work that they have done for this country, and I wish them well in the years that lie ahead. Thank you, Madam Speaker, and may God bless us all.